Who's this? Eric Kriner, respiratory therapy clinical specialist at MedStar Washington Hospital Center. At MedStar Washington Hospital Center, I'm a respiratory therapy clinical specialist. The respiratory therapists assess patients, assess their need for therapy, and manage the therapy throughout the course of a patient's stay. The therapists, in simple terms, take care of patients on the ventilator. But within respiratory therapy, the clinical specialist role also takes on education for our respiratory therapists, for nursing, for the physicians, for the advanced practice providers. It also has a degree of research within the position as well as quality and informatics and safety. I've been at MedStar Washington Hospital Center since May of 1997. Started here as a respiratory therapist, knowing that I wanted to be an educator in some way or some form. And in about 2001 to 2002, in that area, a director of clinical education role became available at Prince George's Community College. So I learned how to teach. So I elected as the director to still do my own clinicals, and I brought my students here. And I also worked here PRN. In 2009, I left academia and I came back here in the role that I am in now. The best part of my job at MedStar Washington Hospital Center are several different things. We started a mechanical ventilation course that has really just exploded over the last 15 years. It has gone from mechanical ventilation education for our fellowship here to go outwards towards all of the fellowships in the entire Maryland, DC, and Baltimore metropolitan areas. University of Maryland and Johns Hopkins and Walter Reed Bethesda Naval and the NIH, Howard, they all send the fellows to this mechanical ventilation course that started out with an idea. That same educational course has now expanded to 18 other academic medical centers across the country. And so now we provide a standardized mechanical ventilation education for pulmonary critical care fellows at a very, very high level for about 25 to 30% of all the fellows across the country. In 2012, I was recognized as the Acute Care Practitioner of the Year by the American Association for Respiratory Care. And in 2022, I was inducted as a Fellow of the American Association of Respiratory Care. Because of the practices here and then the continued professional growth outside, those recognitions have been touching to me as a reward for all of the effort that I've put into here. I have 4 children. My eldest is 23. I have a 21-year-old daughter. I also have 2 13-year-old twins. My wife is a respiratory therapist as well, who used to work here at MedStar Washington Hospital Center. Met my wife here. The twins are preemie twins. They were born at 26 weeks gestation. We stayed in the MedStar system. We went to Harbor Hospital. She was on bed rest for the next 5 weeks. I would come home every day from MedStar Washington Hospital Center, pick up my kids off the bus, and we would go sit in another hospital. September 30th, 2012, at 26 weeks, we were transferred to MedStar Franklin Square Hospital. We delivered, and we stayed in the MedStar Franklin Square NICU for 126 days. Everybody here took care of my family. The 4-H burn unit that year bought our Christmas presents. They did Christmas for us. We had dinners every night, courtesy of everybody, my work family here. And then the MedStar Franklin Square people took exceptional care of us. To say that my MedStar roots are established is an understatement. I've seen every aspect. We've grown literally from the ground up at MedStar.